October is Breast Cancer Awareness Month now. In the last half hour of Good Morning Texas, we talked about how to catch breast cancer early. But Joe, knowing your body can help save your life. Yeah, no doubt about that, Andrea. I'm joined once again by Michelle Wilson with the Baylor Scott and White Hillcrest Breast Center with recommendations for self-breast exams. And we talked about this earlier. Michelle, thanks again for joining us. There is some debate, though, when it comes to breast exams. Should women regularly check themselves, and how do you perform a self-exam?
I always say you should be body aware. They stopped recommending self-breast exams monthly for women a couple of years ago because of anxiety and whatnot. I'm still an advocate of knowing your body, knowing when something's not right. In order to do that, you have to look, you have to touch. So I still perform monthly breast exams, and we still recommend it. And not just feeling the breast, but looking at the overall outer skin and making sure that it's healthy as well.
Okay, what should women be looking out for?
Anything that's red on the skin, any nipple discharge or color changes, anytime you feel a lump that is new for you or that is changing, those are things that make you want to call your doctor, say, I feel something new, I see something different, and get in and get it checked out.
And if you think you found something, what should happen after that as far as calling your doctor?
Usually you'll call your doctor, you'll go in, they'll feel it, confirm that they feel what you're feeling as well, and then they'll get you set up to come in and have a mammogram and or a breast ultrasound.
Give us an example. I know you've done this for a long time. You said earlier in the last hour that you do these a lot, and you've seen people who've actually come in and maybe they found something and get it taken care of. Give us an example of someone like that you've seen where they've come in, they were aware of something, they ended up getting breast cancer, and then maybe they survived and went on and lived a fulfilled life just because maybe they saw a segment or maybe they saw you and you reminded them of that.
Happens every day. I had a lady actually stop by my office that was in our imaging center last week, 2 weeks ago, and she wanted to come by and see, and she was like, thank you so much. And she said, at a health fair, you showed me how to do a breast exam. She's like, it was because of you that I found the lump, came in, she's had bilateral mastectomies, her choice. It wasn't, she didn't need both breasts removed, but didn't want that worry. And she was like, I'm 2 years out, and she was like, and I'm doing great. So I mean, it happens every day.
How brave. That's awesome. Yeah, good for her for doing that. And address this real fast because I know we talked about it. I covered it a little bit just a minute ago on the last hour about men. Men are sitting there thinking, well, this is just my wife's issue or my sister's issue or my mom's issue. And it's not. It's a male issue as well.
It is not. And usually when it happens in a man, the symptoms for them are they start experiencing a lump directly behind the nipple most of the time. And so they'll come in and we can do a mammogram on them. And most men are like, oh, wow, I never thought I'd be in here.
Right.
Yeah, they have a different respect for their wife after that. But it's still not bad. Just a little bit of compression, then we'll do an ultrasound and we can tell what's going on in their breast as well. And they can have a mastectomy just like a woman can.
Yeah. All right, Michelle, thank you for letting us know about this great information. Obviously, it's needed because of the month. And it's never a bad thing to have you in here and talk about this.
Absolutely.
So,
Thanks for having me.
Michelle Wilson, thank you.